Hello everyone and welcome to another informative video of Professor Giuseppe Rosano. I'm Abby, your friendly medical correspondent. Today I'm excited to present Professor Rosano. He will be speaking his thoughts about dozens comments and questions made by HCP viewers for his last videos. How best to discharge your patient with heart failure and an innovative way to treat heart failure, emphasis on cardiac metabolism. Before you are hearing Professor Rosano's feedbacks, you may want to revisit full videos made available in the P2PMD playlist under Giuseppe Rosano Collections web links shown below. Now, let's listen up and learn from the best together.
In my opinion, the vulnerable phase is before hospitalization.
The definition of the vulnerable phase is 90 days post-hospitalization.
Aside from decongestion, will traditional factors play a role in the prediction of a higher risk of readmission among patients with heart failure?
Not the traditional risk factors, natriuretic peptide levels, and lack of full implementation of foundation therapy for HF are the stronger predictors of rehospitalization.
Shouldn't I use beta blockers in vulnerable patients?
Yes, absolutely. Alone or in association with ivabradine in patients in sinus RHYTM.
In decongesting patients with heart failure, what additional management can be used for the prevention of cardiorenal syndrome?
Use sequential nephron blockade and avoid dehydration.
How beneficial do you think it would be to administer the influenza vaccine immediately after discharge?
It is safe in patients once stabilized.
What about ivabradine instead of beta blockers at pre-discharge?
Ivabradine can be used in association with low-dose beta blockers.
Are beta blockers dangerous at dismission as they reduce contraction?
They should be used with caution.
What about metabolic therapy with Trimetazidine at post-discharge?
Trimetazidine can be implemented at any time, as it does not have any negative chronotropic or inotropic effect.
Is Entresto good in patients with preserved EF?
The Pioneer study did not demonstrate efficacy in HF-REF. It is effective in HF-MREF.
I think ivabradine is good in patients with low blood pressure.
Absolutely. Will enable the use of other foundation HF therapy.
How does SGLT2 act?
Mostly through an improvement of cardiac metabolism.
What do you mean for wet?
Patients who are still congested.
Among the different mechanisms of heart failure, which pathway would you recommend targeting first in order to avoid further complications and end organ damage?
All pathways should be targeted simultaneously, including RAAS activation, adrenergic overactivation, SGC suppression, and cardiac metabolism.
Professor Giuseppe Rosano. Is Trimetazidine useful also for patients with HF-preserved EF?
Mostly in those with altered glucose metabolism.
When administering Bendavia to patients who suffered decompensated heart failure due to a recent myocardial infarction, would you recommend waiting for results from early coronary reperfusion, thrombolytic therapy or percutaneous intervention, or would it be beneficial if administered simultaneously?
Bendavia is not yet in the market. Early studies have demonstrated efficacy in dogs who had undergone ischemia or reperfusion.
In the meta-analysis presented, Trimetazidine showed a protective effect on patients with heart failure with reduced ejection fraction. How about patients with heart failure with preserved ejection fraction and heart failure due to other causes aside from ischemia and diabetes? Will starting on Trimetazidine be beneficial to these patients?
The effect was similar in patients with ischemic and non-ischemic heart failure. There are no prospective data from RCTs in HFpEF.
Can I combine Trimetazidine with glifozins in all patients? Or just in subgroups?
Yes, it can be safely combined.
I tried coenzyme Q10 and Trimetazidine, but patients improve only with Trimetazidine. Both improve mitochondria function. If glucose is so good, why are diabetic patients at risk?
CoQ10 has not consistently demonstrated efficacy in HF. Diabetic patients have high plasma glucose levels but low intracellular glucose. Restoring glucose utilization improves cardiac function in diabetics.
Does trimetazidine improve AF?
Trimetazidine does not have a specific effect in HF.
Thanks for watching. I hope you found Professor Rosano's insights and answers to your questions practically useful in your clinical and research work. To learn more about Professor Rosano's scientific works and what he has in mind, please check out Giuseppe Rosano collections in P2PMD playlist, with web links provided below. Professor Rosano has just demonstrated the value of P2P platform by sharing great scientific minds with their global peers in a direct, autonomous, quick, simple way. Stay tuned for more from other medical leaders on P2P.
If you have any captivating insights that you would like to share with your peers, please email your thoughts to kol@p2pmd.net. Here at P2P, we welcome collaboration with the brightest minds on the planet.